The obvious early symptoms of drug or alcohol dependency are when the person starts to cause themselves harm or cause the people around them harm or concern. Not necessarily at a severe level to begin with, but when we regularly start having to waken up in the morning or have discussions with people where we have to start apologizing for our behavior, then that begins to become a feature of the clients that we would normally see in the clinic. Of course, if that behavior is not addressed, then progressively over the course of a period of time, it's likely that their behavior will continue to deteriorate and the amount of harm that they continue to do to themselves and others will escalate, and therefore we would be most likely to see clients attending the clinic where their relationships have been damaged, their health is beginning to suffer, their emotional health is beginning to suffer. There are difficulties perhaps in an employment situation. They may have already lost their job, they may be suspended. The children could be living in fear of or uncertainty of what's happening in the family home. The partner, wife, husband is concerned about their partner's behaviour. There may be police involvement, there may be social work involvement. Now, some of these things will happen, some may not happen, but if there are a version of these sorts of things happening in your life, and if these things are related to drugs and alcohol, then I would suggest that it's time to have a look at those problems and investigate whether or not these problems are in fact caused by the drugs and the alcohol, or is the person using drugs and alcohol to deal with some of these life problems. That is what is sometimes required for the individuality of the client. We cannot make an assumption that everything is caused by the drugs and alcohol. Sometimes they use drugs and alcohol to cope with life difficulties, and a very careful assessment of that is required at the beginning so that we can see the best way forward.